Assalamualaikum. Today I will present about introduction. Electromyography (EMG) is an electro-diagnostic means technique for evaluating and recording the electrical activity produced by skeletal muscle. EMG is performed using an instrument called an electromyography to produce a record called electromyogram. An electromyograph detects the electric potential generated by muscle cells when these cells are electrically or neurologically activated. Repetitive nerve stimulation of peripheral nerve is a simple as well as the most commonly used electrodiagnostic test for the diagnosis of myasthenia gravis. Amplitude of the muscle action potential with stimulating at 2 to 5 Hz. At least one muscle is considered consistent with the diagnosis. RNS is relatively specific in 90%. Muscle action potential. If EPP is it, the whole generate MAP. See MAP. Sum of MAPS generated by no of fibers. Safety factor. Amplitude of EEP above the whole need to generate MAP. In this picture show a typical decremental response to repetitive nerve stimulation in myasthenia gravis. The amplitude of the initial response is normal and the decrement is maximal in the fourth response.
Disease that suitable for RNS test. First, botulism. Botulism is a rare potential fatal illness caused by a toxin produced by the bacterium Coridium botulinum. That disease begins with the weakness, blurred vision, feeling tired and trouble speaking. Second, LEMS. Lambert-Eaton myasthenic syndrome. LEMS is a rare autoimmune disorder of the numerical junction. It is a miscommunication between the nerve cell and the muscle that lead to the gradual onset of muscle weakness. Third is CM, coccidioidomycosis, CM, a disease due to a fungus called Coccidium immitis. About 40% of people infected with the fungus develop symptoms. Most of them, they have an influenza, like illness with fever, cough, headache, rash, and muscle pain. The last one is meningitis gravis. Repetitive nerve stimulation (RNS) is an infection way to further the NMJ and cause acetylcholine depletion. These students are abnormal in more than 60% of myasthenic patients. A decremental response on RNS is the electrical collect of clinical muscle fatigue and weakness in myasthenic patients. Electrode attachment on subject. Repetitive nerve stimulation is a study of nerve condition using electrical stimulation repeatedly 7 times by placing a several electrode. Surface electrode is a non-invasive electrode that's suitable attached on human skin. Next, follow the guide of electrode color code to run the RNS test. First, black, an active electrode. Place the thumb muscle. Red, a reference electrode placed on the thumb and muscle. Green, ground electrode. This electrode can be placed on any muscle that not relate to the muscle on test. T-handle simulate. Place the T-simulate on medium nerve location. Location of electrode placement. Active electrode we put at the thumb muscle. Reference electrode we put at the thumb and muscle, and ground electrode we put at the behind of patient hand. Thank you.
Procedure RNS test. Firstly, open the application for EMG test and choose the new case. Number 2, proceed to register new case for EMG operation in the window below. Number 3, once case details are filled out, you may click Exam to select EMG examination to undergo. Number 4, In module select window, choose order and click add RNS. Number 5. Make sure EMG hardware is on and connected to the PC. Connect the EMG electrode and simulation electrode to the amplifier and place to onto the subject target nerve with electrode port. Number 6. Click impedance to check impedance value of electrode connection. Number 7. Set current stimulation intensity at 10 until 50 mA depending on the subject's skin thickness. Number 8. Set the total number of stimulation 10 until 100 pulse. Number 9. Choose the frequency of the pulse right below the waveform display area. Number 10. Click single to verify the location of the nerve to stimulate. 11. If the position of the nerve is confirmed, click F. Continue. Multiple stimulation pulse will be sent to stimulate the nerve. Number 12. If a stimulation session is complete, amplitude data will be displayed below the waveform display area. Result: EMG graph and response on subject. Firstly, results show the normal waveform when 10.0 mA current stimulation given to the subject and produce the amplitude data display. Second, results show the normal waveform when 40.0 mA current stimulation is given to the subject and produce the amplitude data display. Third, results show normal waveform, but at the end of the waveform is abnormal because the subject feels pain and cannot hold the 50.0 mA current stimulation that given to the subject and produce the amplitude display. Conclusion: in case of extreme serious GMG, including myasthenic crisis, the RNS test is often usual. As a result, performing CNE jitter analysis is critical for an accurate early diagnosis. Based on this finding, we propose that in the Lyme axial presentation of MG, a shoulder muscle such as the trapezius be examined first, followed by the insinus nasalis muscle in predominant bulbar MG. RNS is not responsive in ocular MG, so jitter can be done in the facial muscle.